Hello, my name is Meera Hoffman, and in this video series we're going to be showing a full body massage sequence that you can use on your friends and family to help them with all sorts of various pains in the back, neck, legs, really just anywhere. So please subscribe to our channel, favorite this video so we can help you help others. So today I'm using this Cocoa Shea All Natural Shea Butter. It's unrefined and is fantastic. Just taking my first stroke to apply that down the back. Working fully from the top of the shoulders, the full surface area that I'm going to be working on today. Having a nice return stroke along the sides. Coming out the shoulder blades onto the deltoids and coming up the shoulders into the neck. On the second stroke, I'm going to come with loose fists down either side of the back. Working nice and slow, but applying quite a bit of pressure. And just watching your client's breath, making sure that it's nice and relaxed and easy. If it looks like they're holding their breath, that may be an indication that the pressure is too much. And you can always ask them for verbal feedback as well. If there's anything that you can adjust to make this session more enjoyable for them. I'm working the full length of the spine, all the way down into the sacrum. I'm going to turn and come to wring out the side. Slowly lowering my hands towards the table. And returning back, working towards the spine. Really focusing on creating kind of a shearing pressure into the erectors, the muscles on either side of the spine. Coming out the top of the shoulder blade, just kind of following the edge there. And scooping up the neck. Working on either side. And we'll do the same thing to the opposite side. So using our fists once again to work down both sides of the erectors. Moving nice and slow, really taking your time to feel what's going on, noticing any areas of tension. I'm just making a mental note that that may be an area you want to come back and spend a little bit more time in later. Working all the way onto the sacrum. When I get to the sacrum, I kind of adjust the pressure, so not as much pressure because there's just not as much tissue on the bone there. And then turning to come alongside, working up and down the muscles of the low back. Alternating our hands as we work towards the table and then back up towards the spine. Slowly coming to the tops of the shoulder, tracing the scapula, and then pulling back. Coming up the side of the neck. Working fully to the base of the skull, the occiput, before ending that stroke. And I like to do a nice balancing stroke, just returning to that opening effleurage stroke that we did to apply our shea butter. And just kind of bringing together both sides, giving that sense of balance. Pressing down on the shoulders, can really apply a lot of pressure here, creating some space between the tops of the shoulders and the ears. And using our fingers to apply pressure and the muscles on either side of the neck, and working again all the way up to the occiput. We'll come onto one side of the shoulders and begin to knead, just kind of scooping and pulling the muscles up away from the bones. Working to just try and draw the muscles up, and also paying attention to any areas that may be tight. You can extend that to come onto the shoulder blade a little bit, into the back of the arm, and down the deltoid. And every time I come back into the neck, I'm really applying pressure inwards into the medius part of the muscle, allowing my fingertips to work slowly over the full surface of those muscles. And doing a few circles at the base of the occiput to close that move. Come onto Corrina's right shoulder and do some nice kneading here. Just trying to work thoroughly into the rhomboids and levator scapula and the traps, all the good shoulder muscles. Coming onto the scapula, the shoulder blade, kneading the back and the top of the arm into the deltoid. And again, having this nice return stroke going really slowly. Applying firm, consistent pressure. So I can tell for Corrina that she has quite a bit of tension in here. There's a few knots that I've already felt. So just making a mental note when we turn over and work on the neck that I want to save some extra time to invest in that area. I'd say neck and shoulder tension and pain is the most common for people, alongside with low back pain. Another move that we can do on the neck right now is some kneading, almost like a cat. A mama cat was picking up her kitten. So just kind of scooping the muscles on either side of the spine, drawing them together, using about medium pressure here. If I was to press really firmly, might be a bit too much. And just trying to work nice and thoroughly. And that's where I'm feeling the tension, is right in here. I feel like little pebbles, or like the tissue just feels a little bit firmer, whereas like the surrounding areas feel pretty soft. This is a good way to kind of understand an area that may be carrying more tension if you're not accustomed to doing body work. And you can also ask your partner. Sometimes areas that are tense can be a little bit more tender or sore. Or sometimes I'll notice the opposite, where it's like an area that's so tight, I have to apply a lot of pressure for the person to even feel it. It almost feels like bone, but I know it's not. I'm just closing out that kneading and working on either side of the neck. I'm gonna return and bring cohesiveness to the full back by applying my fist down the erectors again. And I use any movement where I kind of work the full back as a good connecting stroke. From an energetic perspective, when you start to release tension in one area, it feels really good to have an intermediary stroke that allows the person to carry that wave of relaxation throughout their back and throughout the body. It creates a deeper sense of relaxation and enjoyment. To do a little bit of work on the low back. So just as we did before with the kneading, to kind of open up the area, we can knead the low back muscles. And even into the erectors, kind of working up towards the shoulders. Just doing your best to kind of lift and grab the muscles, even though they're a little bit smaller. You're not going to get as dramatic of a movement here. I'm working all the way into the SI joint, the sacroiliac joint. It's right here where the sacrum joins into the iliac crest of the hip. And doing this a couple passes. With each pass, you're able to work a little bit more deeply and facilitate deeper relaxation. And we'll come into doing some more focused work by melting into these low back muscles. Just allowing your fingertips to find that point of tension where the muscle sort of pushes back. And then just being static, allowing your pressure to melt into those muscles. And giving the client that sense of biofeedback with their body. You can encourage them to take some nice deep breaths to help facilitate the relaxation. can see my hands are slowly starting to drift outwards. And that's totally okay. Or if you want to keep a more targeted approach, you can stop at one point, hang out there for a few breaths, and then move to the next point further out. I'm working all the way out the side. Return by doing some nice opening. One hand drifts up as the other pushes down to close. And see, my hands are just kind of stepping over each other, applying pressure in opposite directions. And we'll come back up out the shoulder. And up the neck. And preparing to do our next intermediary stroke. And take a big guess what it is. That's right, if you said fist on the erectors. And this really is one of my favorite go-to connecting strokes because you can do so much with it. It's like you're really covering a lot of ground, working the full length of the spine. Because you're in a good position, body mechanic wise, you can apply quite a bit of pressure, which feels really fantastic to your client. And it's one of my personal favorite strokes to receive, so that might be why I'm partial to it. I feel like if you only had 5 minutes to give somebody a quick little massage, this would be one of the strokes that you definitely want to include. So already I can tell that the side of the low back that I just worked is a lot looser than the side that I haven't worked yet. So I'm going to come over to the side that hasn't received that work and coming back into the kneading of the low back and the rectors and the mid back. Tension here. The muscle just feels a little bit tighter, almost as if you imagine like a rope or a rubber band. The more tension or taut it feels, the tighter the muscle. And so your opportunity is to try and encourage relaxation into that area. And then we'll come into melting into all those nice low back muscles. On the other side, I just showed kind of like a single hand pressure. But if you want to intensify the work, you can use your opposite hand to apply pressure inwards. This allows more force to be carried through your hands. But just check with your partner, because if they have low back tension or tenderness, that may be too intense for them, so just check about the pressure. So on the last side, I kind of showed my fingers slowly migrating outwards. And this one, I'm going to hang out and kind of be more specific. Working on one spot and kind of waiting till I feel that release. Once it's loosened, you can kind of pick your fingers up a little bit and move about a centimeter outwards, depending on how big your client is. Just looking for that next pocket of tight muscles. as the muscles begin to relax, you can let your fingers melt in a little bit more deeply until you feel that resistance point again. It's kind of a subtle dynamic, so definitely play around with it. And moving to the next spot a little bit further out. Slowly close by doing that alternating hands, working up and down the spine, coming out the top of the shoulder and up into the neck. Some nice little circles here. We'll close with our connecting stroke again. Just tying everything together. So again, seeing that flushing, that circulation increasing. With the redness in our skin, it's just an indication that circulation is increased in that area because the muscles are relaxing. And because of our work. Slowly working all the way down the spine. Coming out the sides, up the back, pressing down with intention onto the shoulders, scapula, out the deltoids, rounding over the shoulders, scooping up the muscles of the neck, and making like little wavy motions with your fingers, turning into circles. To conclude our back massage. So that was part 1 of our series on full body massage, working on the back. Please favorite this video so you can come back and follow along with a friend. My name again is Meera Hoffman. You can find out more about me and my practice at meerahoffman.com. And subscribe to the Psychetruth YouTube channel. We have thousands of videos to help you with health and wellness.